Epinephrine, which is contained in the EpiPen of either an adult dosage or a children's dosage, is the active ingredient of the autoinjector. It's the only first-line emergency treatment for anaphylaxis or airway constriction. Antihistamines, such as Benadryl, are commonly used for treatment if you start breaking out in hives or a lot of itching or lip swelling occurs. In a mild case, you could take some liquid Benadryl, but anything that's life-threatening, such as airway constriction, you want to use the epinephrine that's contained in the EpiPen whenever you have symptoms of anaphylaxis. Symptoms may include swelling of lips and tongue, itchy throat, coughing, tightness and closure, weak pulse, dizziness, passing out, wheezing, shortness of breath, diarrhea, cramps, nausea, vomiting, itchy hives, redness and swelling of the skin. There are a number of causes of anaphylaxis that we will discuss. Number 1, foods. The most common foods are peanuts and seafood, but it can be any kind of food allergy. 2, exercise-induced anaphylaxis. 3, insects such as bees, ants, wasps. 4, inoculations such as flu shot, tetanus shot, and immunizations. 5, drugs such as penicillins and other antibiotics. Some unknown reasons of anaphylaxis include latex allergies. Some common side effects of using epinephrine include increased heart rate, stronger or irregular heartbeat, sweating, nausea or vomiting, difficulty breathing, paleness, dizziness, weakness, shakiness, headache, apprehension, nervousness, or anxiety. For the EpiPen, we prescribe them at 35 pounds to 65 pounds, which is the EpiPen Junior containing 0.15 milligrams of epinephrine. The EpiPen for adult dosage is 65 pounds and above, which is 0.3 milligrams of epinephrine. We prescribe them in a dual pack. If you don't get immediate relief within 3 to 5 minutes after using it, you need that second dosage. In order to use the EpiPen, you must first remove the autoinjector from the clear carrying tube. It should be a dual-pack tube. You flip open the yellow cap of your EpiPen autoinjector or the green cap of your EpiPen Junior. With one hand, slide the autoinjector out of the carrying tube and grasp the autoinjector with the orange tip pointing downward. With your other hand, you're going to remove the blue safety release by pulling straight up without bending or twisting it. To administer the EpiPen or the EpiPen Junior autoinjector, you hold the autoinjector in your dominant hand with the orange tip near the middle of the outer thigh of your upper leg. Next, swing and firmly push the orange tip against the outer thigh until it clicks. Keep the autoinjector firmly pushed against the outer thigh at a 90-degree angle. Hold firmly against the thigh for approximately 10 seconds to release the medication. The injection is now completed. As you remove the autoinjector from the thigh, it's going to encapsulate that needle. You'll want to massage the area for 10 to 15 seconds. Next, you would make sure that you get to the emergency room, even if you're starting to feel better, as you may still have some side effects and need to be evaluated. We usually recommend to the patients that they go by ambulance because if you have any issues on the way there, they will know how to treat you. Always inject into the outer thigh, never injecting into the buttocks or other areas such as the hand, fingers, legs, or toes. You always want to keep your EpiPen in your possession at all times. You don't want to leave them in a car because heat will ruin them. There's a clear window on the outside of the EpiPen. This window should always be clear. If it ever becomes discolored, then it's no longer effective. EpiPens remain good for 1 year. When you pick up your EpiPen from your pharmacy, be sure to look at the date and make sure that you have a 1-year expiration date. Do not put them in the refrigerator. If you have children that have allergies, it's best to keep a dual pack at home and a dual pack at school. Usually they will need a consent in order to do that, which the school provides. We do not provide those consents. We can fill everything out, but each school has a particular consent that they want you to give to your physician to have it completed. You can register your EpiPen by going to EpiPen.com. They will send you a complimentary EpiPen welcome kit, which contains tips for your action plan brochures and a copay card. We also provide those to you here, so you can continue to use those copay cards for every refill. It includes an EpiPen card that contains allergy information to let them know what to do in an emergency and what things should be avoided, such as food allergies. They have an EpiPen Plan app brochure that can be used for either an iPhone or Android. They also have EpiPen patient information, storage information, instructions for use, and safety precautions. You may then register for a free complimentary carrying case, which is available in 4 different colors. There is also an app that has a tutorial which you can watch if you forget how to use the EpiPen. Also, with the dual pack, they are going to give you a trainer to practice with. Make sure that you are using the trainer at all times when you're practicing. We advise to keep the trainer separate from the real one so somebody doesn't accidentally use the real EpiPen. You can go to EpiPen.com or pull up the app on your phone anytime to watch those. We always advise teaching other members in your home to know how and when to use the EpiPen as well. Thank you for preparing for your upcoming treatment. When you arrive for your first appointment with us, we will answer any additional questions you may have. Please be prepared to sign the acknowledgement of your completion of the video. Thank you again for choosing Acadian Ear, Nose, Throat, and Facial Plastic Surgery Center.